Okay, so we'll quickly be looking at another concept in pharmacology. This is what is known as what? Distribution of drugs in pharmacology. So when they say talk about distribution of drugs in pharmacology, what do they mean? Okay. So I've introduced a lot of concepts. So let's look at yet another one. So in pharmacology, we are saying that the distribution of drugs actually refers to what? The journey that the drug takes from the bloodstream into various tissues, organs of the body after being absorbed. Okay. So it is like what the drugs what in itinerary after it catches a ride on your what circulatory system. So where does the drug actually reach if you get hold of your circulatory system? So different tissues receive what? Varying or different amounts of drugs depending on several factors. So what are the factors affecting how a drug is distributed in the body? So if you take these drugs, to what extent does it reach part of the bodies? Right? That's what we're trying to talk about. So blood flow. We say that organs with higher blood flow, like the liver, kidneys, and brain, of course, they receive drugs sooner than those with lower blood flow. Plasma protein binding. Drugs that bind to proteins in blood, affecting affecting how much of the drug is free to interact with tissues. Okay. Tissue binding. Some drugs tend to accumulate in certain tissues, can actually act as reservoirs. Molecule size and lipid solubility. So these characteristics influence what? A drug's ability to move across cell membrane. Okay. Also volume of distribution. So as a key pharmacokinetic parameter that helps quantify the distribution of drug within the body. It is defined as the volume in which the drug would need to be uniformly distributed to produce the same concentration as in blood plasma. We'll talk about the volume of distribution differently. Alright. So but this is just the basic thing about the distribution of drug where you're talking about it in pharmacokinetics.